My name's Atkins. I'm a physician at the transplant and cell therapy program at the Ottawa Hospital and also a scientist at the Ottawa Hospital Research Institute. It was kind of in the mid to late 1990s where people noticed that patients having a stem cell transplant for a cancer but also had an autoimmune disease would often have the autoimmune disease get better after their transplant. We developed a protocol. It took almost 3 years to get the protocol developed and approved for funding. And we started out by doing stem cell transplants on patients who had ongoing activity of their multiple sclerosis, but before they got terribly disabled. And we treated those patients and then followed them for a very long time and really showed that in that study that stem cell transplant halts any activity, either clinically or by looking at brain imaging related to the multiple sclerosis. And that a little bit more than 2/3 of the patient, their disabilities didn't get worse over that time. A stem cell transplant is a complicated procedure. There are 2 steps to it. The first step is collecting the stem cells, and the second step is wiping out the immune system and putting back the stem cells. And the stem cells regrow into new blood cells and new immune system. We can collect the stem cells by washing the patient's blood through a special machine we have called an apheresis machine. And it essentially takes blood from their arm, passes it through a machine that is a centrifuge, and that layers out the blood cells, and we put a little nozzle in the layer with the stem cells and collect it in a bag, and the rest of the blood goes back in the patient's other arm. And so we wash their blood for about 4 hours that way, and we collect enough stem cells. Once the patient has recovered, well, then we start the stem cell transplant, and that involves giving 3 drugs over the course of 10 days to destroy the immune system. It has a lot of other effects. We then bring the stem cells from the lab, from the freezer, and we thaw them in a water bath, and we infuse them into the patient's arm, and they circulate around and end up in the bone marrow and start growing. They form new blood cells over time and new immune system. By about a year after, they're back on their feet and back to how they were before the transplant. It's not a panacea for everybody, right? So there are selected types of MS where the disease is aggressive enough that it warrants this kind of treatment. We can't be satisfied with where we are. We've developed something over the course of the last 20 years or so, but there's still more to do to make these treatments better and to look for new tools to do it more safely, more effectively. It's something that our hospital provides. It provides the environment to be able to do that and to develop new programs to make people better.